Travel is opening up again as more people get the COVID-19 vaccine. And in today's Healthy Habits with Dr. J, Dr. Lana Joseph Ford is going to share how you can make your next travel experience a little more comfortable. Dr. J, can you hear me?
Yes, yes, yes. I can hear you, Malik, and I'm excited about talking about this. It's
Yes,
fun.
because what we're talking about today is one of the most common travel experiences, ear popping. We're going to get to that in just a little bit. But first, I want to ask you just overall, what are some of the issues travelers experience with their ears?
Oh man, Malik. So first we mentioned about the most common complaint is popping of the ears, right? But there are also some other things that travelers can experience. As that plane descends and ascends, and the pressure in our ears are changing. So we've also seen people complain about having ear infections or ruptured eardrums as a result of that elevation change while riding on an airplane. And a lot of time that results from people getting on the plane when they have a sinus infection or a severe cold. So we need to make sure we're watching that.
Absolutely. Now, let's talk about something that I experience every single time I get on a plane, ear popping. What is happening, medically when our ears pop on an airplane?
Yeah, so that is the eustachian tube. So we have a eustachian tube that's a part, it's actually a tube that's between our eardrum and our throat. And it's very important because it does help us with equalizing pressure. So when that eustachian tube cannot equalize the way that it's supposed to, that's when we feel that popping sensation. And obviously, as airplanes ascend and descend, especially when that flight elevation changes, which we know in an airplane, I mean, we're going like 300 miles an hour. So that's happening really, really fast, right? So our eustachian tube can't keep up with it, and it's causing that popping sensation that just makes us want to cringe.
Right? So it's not necessarily a bad thing. It's just really a natural reaction that
Mhm.
our ears have because for most people, I hope it's only temporary. But for people like myself who are curious how we can alleviate that ear pain while we're on a plane, what are some tips you can offer us this morning?
Sure, sure. So of course, chewing gum, right? That's one of the things that we talk about all the time. Swallowing is very helpful. All of these things are helping us with alleviating that pressure buildup in the eustachian tube, which is right here, by the way. So as we're chewing, we're having that pressure change. We're feeling that, right? The one that I hate the most is the Valsalva maneuver, but y'all love doing it all the time. And that's when you're holding your nose and you're blowing really hard and it causes your ears to pop. Again, that's not your eardrums actually popping. That's actually a result of you equalizing or helping your eustachian tube to equalize that pressure that you're feeling as that plane ascends and descends. And finally, my favorite is just get some custom earplugs to help you with your traveling. It'll help to alleviate the need to swallow, chew gum, or do that Valsalva maneuver. Because what's happening is with those custom plugs, it's making sure that your jawline is also aligned with where your ear needs to be in order for that pressure to continue to be equal. And because equilibrium, of course, as we know, is extremely important. And that's what we need use our eustachian tube for. To make sure that our body is equalized in the area.
Very, very interesting. For most people, hopefully the only thing you have to deal with is that ear popping sound. But for some, it may get worse than that, like maybe your eardrums bursting. Is that possible when you're flying?
Yes, unfortunately, that is possible. And we've seen it when people don't listen to their doctor and they get on these airplanes with sinus infections and allergy issues and they're sick. And instead of not flying, that's why your doctor will advise you not to travel when you're sick. It's because as the plane is ascending and descending, that pressure again is changing rapidly. It's changing so fast that our bodies can't necessarily keep up. So your body is going to naturally do what it does, which is try to find the equilibrium, right? Try to equalize pressure. But if you've got the sinus infection on top of the pressure issues, then what we're going to see is we could potentially see a ruptured eardrum.
And we do not want that to happen, everyone. Like she said, always consult with your doctor. Dr. J, thank you so much for joining us this morning. I'm going to keep chewing gum, my sister. I promise. And hey, if you're looking for an audiologist, Dr. J has two high-level speech and hearing locations, one in New Orleans on Magnolia Street, and the other is in Harahan on Jefferson Highway. To set up an appointment with her, just call 504-345-2984 or check out her website, highlevelhearingnola.com.